Good morning, America. Hope you all are well this Thursday morning. We do want to get right to that coronavirus crisis. Take a live look at the cruise ship terminal in San Francisco, where that boat is expected to dock later this afternoon after a former passenger died with coronavirus.
The number of cases worldwide has now climbed past 95,000. The UN is reporting that nearly 300 million kids are missing school because of the outbreak. Here in the U.S., we're seeing schools temporarily close on both coasts.
There are now at least 159 confirmed cases of coronavirus here in the U.S. 11 people have died. This afternoon, the Senate will vote on an $8.3 billion emergency funding bill to help battle the spread.
Dr. Ashton and her team are here to answer your questions this morning. There she is right now.
Yep, to clean your surface.
But Whit Johnson starts us off outside the Manhattan Hospital where one of the victims is being treated. Good morning, Whit.
George, good morning to you. What we're seeing here is the extraordinary ripple effect associated with this virus. This one patient at this New York hospital impacting hundreds of other people. Health officials are now scrambling to get a grip on multiple outbreaks from coast to coast. This morning, California declaring a state of emergency following the state's first death in the coronavirus outbreak. Health officials revealing an elderly patient died after being exposed during a cruise last month from San Francisco to Mexico. That ship, the Grand Princess, is now on another voyage, carrying new passengers along with some of the same guests from the February cruise. Overnight, California's governor confirming those 62 passengers are being isolated in their cabins, some complaining of flu-like symptoms. Later today, officials say the Coast Guard will be flying testing kits to the ship.
The ship will not come on shore until we appropriately assess the passengers.
They just told us because of the virus that we were going back to San Francisco, and because of the scare that the events were going to be shut down, but everything else is business as usual.
Across the country, the number of Americans infected climbing to at least 159 and 11 deaths. But Vice President Mike Pence attempting to reduce the nation's growing fears.
If you are a healthy American, the risk of contracting the coronavirus remains low.
Los Angeles County declaring a local emergency, now reporting 6 new cases, including a healthcare worker who is screening passengers at LAX. In New York, Governor Cuomo announcing 11 cases of the virus, leading to 1,000 people ordered into self-quarantine.
There are going to be hundreds in Westchester.
Most of those connected to a single patient, a 50-year-old man now hospitalized in critical but stable condition who was a regular commuter on the train to Grand Central Station. His immediate family now infected, along with another family he came into contact with. In Washington state, families who have loved ones in the Life Care Center nursing home where 6 residents have died from COVID-19 are scared and angry.
We try and visit as much as we can. It's really
Kaylee Hartung sitting down with Kevin Connolly, whose father-in-law is a patient.
How is Jerry describing what's going on inside that facility right now?
He's not. There's confusion. There's a complete lack of information to the families and to the residents.
Also in Washington, King County is setting up a temporary quarantine village with modular homes in the middle of a neighborhood.
That's some scary stuff for me. This is close to home. So, yes, I have a concern about it.
And overnight, Facebook announcing it will be closing its Seattle office and recommending all employees work from home. Amazon echoing similar statements, telling employees in Seattle to work from home through the end of the month. We're also seeing swift reaction in the airline industry. Major carriers are reducing their flight schedules as demand drops, and the International Air Transport Association now says the coronavirus could result in $113 billion in industry losses. Robin?
Okay, with thousands of new cases of coronavirus have been reported overseas in the last 24 hours. Italy, as we know, hit especially hard by the outbreak. Now that country is on virtual lockdown. James Longman just returned from Italy and has more. Good morning, James.
Yeah, good morning, Robin. This is a major step up in Italy. All schools are to close across the country until March 15th. These are the most drastic measures to contain the virus in Europe. There are now school closures of some kind in 22 countries across 3 continents. And with warnings that the United States may take similar precautions, we're now talking about something like 300 million students around the world possibly facing disruption. The United Nations is warning about an unparalleled scale and speed of educational disruption. Italy's also banning fans from attending sporting events. They'll still go on, just 2 empty stadiums. More than 3,000 coronavirus cases have been confirmed in Italy, with more than 100 deaths. And over in Paris, the Louvre is back open, but with new guidelines to make museum staff feel safer. They'll now no longer have to physically restrain those large crowds we see often at the famous Mona Lisa. There'll be frequent breaks for hand washing, and even though there's no evidence the bug can travel on banknotes, employees will now only take credit cards as a form of payment. There are so many changes happening for so many people because of all this. Amy?
All right, James Longman, thank you. And so many questions. So let's bring in our chief medical correspondent, Dr. Jennifer Ashton. And Jen, scientists in China are now saying they've identified a second strain of this virus. What does that mean?
So it was a very small report coming out of China that identified 2 strains of this coronavirus. I want you to think of this just as we know there are multiple strains of the influenza virus. It does not mean that there's been any mutation or change. It just means one is circulating more commonly than the other. One appears to be more highly transmissible, but that doesn't mean more severe. And we still don't know really what's circulating here in the U.S.
Speaking of the severity, the World Health Organization, as you know, says that the mortality rate from the coronavirus is now at 3.4%, and that's higher than the initial 2% estimate. What do you make of all of that?
Again, we've said this from the very beginning. I really caution people not to hang their hat on any given number. This is a dynamic and evolving situation. We're collecting data literally by the hour, and that mortality rate depends on the denominator. It depends on how many people are truly infected, and that number is still unknown.
When we're hearing about the deaths, we often hear they had an underlying medical condition.
Yeah.
What types of conditions are we talking about?
Well, again, the published case reports for this strain and the deaths associated with coronavirus is just still coming out. But in general, we're talking about things like diabetes, high blood pressure, heart disease, some forms of cancer, anything that weakens your immune system, chronic medical conditions, and there are a lot of people living with chronic medical conditions.
Certainly are. Do we know how long the virus lives on surfaces? Do we know that yet?
That's probably the most popular question I've been getting in the last 24 hours. That is unknown. So again, people are looking at that, but a recent study showed in hospital rooms, 87% of room surfaces and 60% of bathroom surfaces contain this virus before cleaning, after cleaning, and disinfection. Those rates went way, way down. That's why I want to clean those hotspots.
Very important information. Still a lot of questions out there, and you're here to answer them. So you can send in your questions for Dr. Jen on Facebook, Twitter, and Instagram all morning with the hashtag AskGMA. She and her team will answer some of them.